This talk is really about sort of trying to put some of the control in your hands regarding how you manage your illness. And maybe it's your family member, how you help your family member manage his or her illness. So we hear a lot of cancer metaphors. The war on cancer was declared by President Nixon back in the early 70s. You hear our patients describing themselves as being fighters, or we're describing others as being a real fighter. We talk about people winning their battle with cancer. Cancer Treatment Centers of America actually has a little phone line where if you have a particular kind of cancer, you can call this number and you will get a person with the same kind of cancer talking to you about the illness. And they call this line the Cancer Fighters line. But it's, for those of you who have cancer, I'm sure some days it feels like a battle, but other days that metaphor doesn't quite fit. This is a mission statement for MD Anderson, which is a big cancer center in Houston, Texas. And they talk about we're making cancer history, and history, cancer is crossed out. So their mission statement is to eliminate cancer, imagining a world without cancer. And I think that's what places like Karmanos is about as well. We have people doing a lot of research on the basic biology of cancer, how to develop new drugs for cancer. But there's also a lot of people who are here studying how patients live with cancer, how families live with their loved ones with cancer, how we communicate with each other. So I think imagining a world without cancer, I think a goal of any major cancer center. However, I think for the present moment, we have to think about how can we live with the disease. So you also hear this idea of having a journey with cancer, your journey. This picture, virtually every cancer center in America has a picture kind of like this. This idea of going down a pathway. And for me, that metaphor is a little bit better than the fighting metaphor. The word journey means the act of traveling from one place to another. Or it can be used as a verb, to journey. And for me, I think it's a better description, I think, of what our patients and families are experiencing. And why do I say that? Well, journeys have a beginning, and journeys have a destination. And your destination is the goals that you have for your journey. Any journey has preparation. You prepare yourself, your family prepares themselves. There's sustenance for the journey. How do you take care of yourself during the journey? And then there are people who journey with you, your fellow journeyers, if you will. So I kind of like this metaphor better in describing the experience that many of you have. So we're just going to break the talk into sort of 3 blocks. The first is, this talk is called Medicine, Mind, and Body. So the first is medicine. We'll talk about how you ascertain what the goals of your treatment may be, how we look at side effects and how we can manage those. The mind-body piece is how do we take care of ourselves. And then lastly, we'll spend a fair amount of time at the end on sort of an aspect of your experience with this I call buoyancy. And a friend of mine sort of coined that term So we're going to talk about how we remain buoyant in the face of an illness. So what about goals of treatment? In many ways, it's kind of your roadmap for your journey. The goals of your treatment will really sort of identify your destination, if you will. And I would encourage you to ask your clinicians, your physicians, your nurse practitioner, what are the goals of my treatment right now? Or when you're first starting a treatment, what are the goals? What can I expect out of this treatment program, and how is it going to get me to my destination? So it's not a stupid question. I would encourage you to ask it. So some goals are curing the cancer so it never returns. Cure means, a year later, 5 years later, 10 years later, the disease is not there. And we have this goal in patients with early stage breast cancer, early stage colon cancer, lung cancer, prostate cancer, melanoma. There's others as well. These are just some of the more common ones. So when we're facing a patient with early stage disease, our goal is to cure the disease, either with surgery or surgery with chemotherapy or surgery with chemotherapy and radiation. Advanced testicular cancer is a curable disease. Some forms of leukemia and lymphoma are curable disease. Cancer of the head and neck region is often a curable disease. So knowing that at the beginning sort of will change the way you sort of think about your time, your family's time, your work, etc. Another goal of treatment that we often have is really changing the disease to a chronic disease so that you can live with it for years and years and years. And that's really a development of really the last 15 to 20 years, to be perfectly honest. The diseases like multiple myeloma, which is much more manageable nowadays. Still a serious disease, oftentimes an incurable disease, but it is a disease that many of our patients now are living for years and years, sometimes decades, and really living a good quality of life. Some forms of lymphoma and leukemia are chronic diseases that patients can live with for decades. A disease called myelodysplastic syndrome is a bone marrow disease, and again, with modern medicines, can be managed over periods of time. And even advanced diseases nowadays, advanced melanoma, advanced colon cancer, advanced prostate cancer, there are a number of new drugs that really has converted these diseases in many patients, not all patients, but in many patients, diseases that they can live with for years and continue to work and continue to have a good quality of life. Finally, another goal is prolongation of survival. So we have a lot of new drugs in the last 15 to 20 years that have been proven to prolong patients' lives who maybe have advanced cancer. And that treatment can sort of keep the symptoms of the disease at bay. So again, people can live a good quality of life. Diseases like this include advanced lung cancer, advanced breast cancer, brain tumors, some certain types, advanced pancreatic cancer. And so understanding the goals of your treatment, I think, will help you plan. Because knowing the goals will help you identify your own personal goals. Well, there's going to be cancer goals, but there's also going to be goals that you have that you may need to accomplish. Knowing the goals is going to help you plan your life. It's going to think about your work, think about family, how you're going to plan time with your family, money planning. There's a lot of things that go into that, and kind of knowing the direction you're going will help you with that planning. And will also help your family plan their lives. Families are spread out nowadays. Oftentimes, sons and daughters are living in distant states, and they have to sort of figure out how they're going to care for their mother, their father, their brother, or their sister from a long distance. And so if they know the goals of the therapy, then they can sort of plan their life as well. So that's really what I wanted to talk about with regards to goals of treatment. Again, I would encourage you to ask your physician, ask your nurse practitioner at the beginning of any new treatment, sort of, what is our direction? What should be our goals for this particular treatment? Next thing I want to talk about is just side effects. All therapies for cancer have side effects. All side effects are not created equal. Some are pretty difficult, and others are relatively minor. So patients really can live with pretty easily. I think your job is to find out what the expected side effects are for your treatment. Somehow you got to walk out the door on the day that they explain things to you with some idea of what the common side effects may be. It's your job and our job. There's always going to be the potential for sort of unexpected, unusual side effects, but for the most part, patients are similar, and normal side effects or common side effects are pretty predictable. So I would encourage you, again, another question to have before you leave is, I know things can be unexpected, but what are the common things that I might expect with this treatment? Just a couple sort of pointers with regards to side effects is, all chemotherapy does not result in hair loss. So there's a number of drugs where you don't lose your hair. Some chemotherapy does not cause nausea at all. So not everybody is going to face that side effect. Appetite is variable. Some people really just eat pretty normally during their chemotherapy. Others have some difficulty. Most people have fatigue. We don't understand that very well, but these are pretty powerful drugs and probably induce changes within the body that produce fatigue. Some drugs cause diarrhea, some drugs cause constipation. So, it's, you kind of need to know the background on that particular drug. Some drugs cause both, but not usually. It's usually one or the other. This is just a list of possible side effects, and this is where it becomes difficult. When someone gives you a laundry list, you're like, okay, well, which ones are really can I expect? Fatigue, infections. So when your immune system is down, your risk of infection. Anemia is a low red blood cell count. Bleeding does not commonly occur, but there are certain programs in which your blood platelet count goes very low and you are at risk for bleeding. Changes in your nervous system. We'll get into that in a bit. Nausea and vomiting, diarrhea, constipation, mouth sores. Again, doesn't happen in everybody. Certain drugs cause it. Most don't. Hair loss, again, for some drugs. Skin and nail changes. And emotional changes. Pretty common, actually. You think about fatigue, you think about emotional changes as well. Pretty common for most of our patients to experience some of that. I'm not going to talk about each one of these. Gets a little bit tedious, but I did want to touch on a couple of them. So fatigue is the #1 complaint of cancer patients, and it is very difficult for your practitioners to know exactly how to manage it. So, by the way, some of these slides are provided to me by the cancer support community, and so I didn't write this slide, but I think there are some of these slides that really give some very good pointers, and I want to point that out. So tips to conserve energy. Ask others to do things. How many times have we heard, oh, if there's anything you need, just let me know. Well, you should just pull out a list from your pocket. So just think about the things that is sort of wear you down. Can someone come over for an hour and a half and do laundry? Somebody pick the kids up from school today or this week. It's my chemo week. I have a hard time getting out at 3 o'clock in the afternoon. Set realistic goals for what you want to accomplish. So taking things in pieces. I think most of us learn that along the way, but it's particularly important when you're on this journey. And then think about when you're most productive. When can you get those short list of tasks done? What time of day is your best part of the day? And what part of the day do you really find that you need to rest? And when you figure that out, then rest during that time of the day. So scientific studies, there's been a lot of stuff on fatigue over the last decade or so. And again, it's been pretty frustrating. We haven't figured out the magic cocktail that makes it go away. Interestingly, the one thing that reliably in scientific studies have been shown to improve fatigue is exercise. And we're not talking about running 2 or 3 miles. We're talking about limited exercise on a daily basis or every other day basis, 30 minutes of walking, that kind of thing. Some people, even that's too much. So I understand that. But if you do have that ability, I would do that. And it goes for caregivers too, because caregivers get fatigued as well. Usually sleep is disturbed when you're a caregiver. You're sort of burning your candle at both ends oftentimes. And taking care of yourself as a caregiver is important too. And again, exercise helps that. Interestingly, there's been a number of studies recently that says if you monitor your symptoms, so all the different symptoms you might be having, and you write them all down, and then you go over that with your doctor or your nurse practitioner, and they help you control those symptoms. If you kind of do that on a systematic basis, and you really take it seriously, fatigue gets better. So as your symptoms get better, your fatigue gets better. That takes a lot of work on both parties' standpoint. We're still waiting for a good drug for fatigue. Sometimes we give people drugs like stimulants. You may have heard the drug Ritalin. Studies don't show that it works very well. Another drug called Provigil probably doesn't work very well either. These are drugs that someone might try on you if you're getting really frustrated with fatigue. And again, supplied by the cancer support community. Tips to restore your energy. Take time to rest. Concentrate on your sleep quality. Nutrition is important. Not always easy, I understand. Sometimes you just don't have an appetite. Sometimes the only thing that sounds good is ice cream. So you have to sort of be kind to yourself with regards to diet and nutrition. Again, we talked about exercise, hydration. It's important, particularly in those patients who may be having trouble with nausea, to make sure that they're well hydrated. And then there are other sort of non-medical strategies that many of you have found help. Meditation, guided imagery, prayer. These are not for everybody. So you sort of pick something and see if it helps you. And places like Gilda's Place, where you can access these oftentimes for no charge, it's a good idea to give it a try. Again, your doctors are not going to have great drugs for fatigue. So many times you're going to be left sort of self-advocating, working on things on your own. It's not always easy. You sort of become dependent on your healthcare team. But I think this is one of those categories where sort of doing things on your own or in concert with your team is going to be important. We try our best to offer those kind of programs here as well, but they sometimes are on the wrong day of the week or wrong time of day for you, and so we don't pretend that we offer it, that it's available to everybody. Some people have to drive long distances to get here. So you maybe have to look in your own community for them. So low blood counts. Your doctors talk to you a lot about low blood counts. There's 3 types of white blood cells: platelets, red blood cells. White blood cells fight infection. So if they go low, you're at risk for infection. The term we use is neutropenia. When you're in a doctor's office and they're talking about chemotherapy side effects, make sure you remember that fever is not a good thing. And so it's an important side effect. Platelets are designed to clot the blood, so when they're low, it's called thrombocytopenia, and when they're low, you're at risk for bleeding. It's particularly true if you happen to be on blood thinners, and it's particularly true in some chemotherapy regimens where the platelet count predictably will go very low. Most of the regular types of chemotherapies we use for the most common diseases, platelet count does not go terribly low. So I would specifically ask your team, how low is my platelet count going to go? How long do you expect it to go? Do I need to be worried about this blood thinner? Because again, most people don't have trouble with bleeding. And then red blood cells carry oxygen. If they're low, the term is called anemia. And having a low red count can contribute to a fatigue. Some of you have had transfusions. Can cause shortness of breath. So if you come to the office and you're tired or a little bit more short of breath, your doctors will undoubtedly check your red blood cell count to see where you stand. This is usually not an emergency, but if you are developing shortness of breath, you definitely need to let somebody know. So again, some key points about blood counts. You need to know whether or not you should or shouldn't be taking blood thinners, even aspirin. You need to call if your temperature is 100.5 or greater, anytime, day or night. Call if there's bleeding or shortness of breath, and then any signs of infection, whether that's cough, sore throat, earache, pain with urination, a new red tender spot on the skin where you had an IV last week, diarrhea, abdominal pain. These are all sort of signs of potential infections that require antibiotics. And if your blood counts are low, you're going to need strong antibiotics, oftentimes in the hospital. Pain is probably the most feared effect of cancer and of treatment. Oftentimes, patients will ask, well, will I experience pain with this new diagnosis that I have? Having pain does not necessarily mean your cancer is getting worse. It could be that chemotherapy is causing some of your pain, and the chemotherapy is working, but you're having some new area of pain because of it. We do a pretty good job of controlling cancer pain, not 100% perfect job. Side effects of pain medicine are a little troublesome. Sometimes they cause people to be sleepy, and you have to trade off sleepiness for pain medicine, for having higher degrees of pain control. But most of the time we can get patients with pain medicine to a tolerable pain level. And I think the fear of addiction's out there. You hear a lot about addiction right now in the newspapers. Most of our patients, if they have pain, they get pain medicine. It's sort of like taking high blood pressure medicine for high blood pressure. It's just sort of a necessary medication. And the fear of addiction in our patient population really is very low. Side effects of pain medicine usually can be controlled. You need to discuss pain. Your practitioners are trained to ask you about pain with every encounter. But you have to tell them that you have it. So sometimes I think people are worried, if I tell them I have a lot of pain, then they might not give me chemo today. They might want to do a scan, and they might want to do an x-ray, and I prefer to keep going on this chemo. So you're going to have to sort of work through that, but I would encourage you to report it and to also describe it. So be specific. Where is your pain? Describe it. Try to get an idea. Is it throbbing? Is it a pinpoint? Does it feel like a burning? What makes it come? What makes it go? What makes it better? What makes it worse? Think about keeping a number chart at home. So, today my pain level was 2. The last 3 days my pain level has been 9. Whatever that may be, keep track of it, and then you can, sort of like diabetics go to their doctors and show them a book with all their blood sugars. You can come in and show a chart with your pain levels. It helps. It gives us a sense of whether the medicine's working, whether we need to go up on the medicine. If you're a little bit sleepy and your numbers look good, maybe we can go down on the medicine. So a lot of this type of reporting is really dependent on you. And we have a hard time guessing. So a lot of this is self-advocating. You know, there's pain control pointers, if you will. If you're prescribed a pain medicine, take it the way it's prescribed. We would encourage you not to skip doses. There's usually medicine available to you if you have pain to take some medicine that will work quickly. We would take it when the pain is early on rather than getting out of control. If you're on strong pain medicine, you need to be on something for constipation prevention. So if your doctor or your nurse practitioner forgets to ask you about that, you need to ask about it. And then again, if your pain's uncontrolled, we need to know. And other things that have sort of been shown to help pain control: yoga, acupuncture, relaxation. So again, your doctors may say, you know what, we've sort of reached the max that we can use on this medicine right now. By the way, there's really no maximum on pain medicine, but sometimes you hit a maximum if patients are having side effects. And your doctor or nurse may say, you know what, we're going to need to do something else to make this medicine work better. So that's where some of these alternative therapies or integrative therapies sometimes come in. Don't work for everybody. It's not always easy to do yoga. It's not for everybody, that's for sure. But your doctors may start thinking about some alternative ways of helping you with your pain control. And it's good, I think, for you to think about that too. The central nervous system and the peripheral nervous system can be affected by chemotherapy. You've heard the term neuropathy. Neuropathy is just a disease of the nerves. A lot of chemotherapy medicines cause neuropathy, which is damage to these peripheral nerves. Peripheral nerves are the nerves that sort of affect your legs and feet and arms and hands. So you might experience tingling or a burning or a needle-like sensation, numbness, hearing loss. These are all changes in the peripheral nerves. And there is medicine that can help that. So it's good to know, again, the character of somebody's pain. You have to be able to tell us what it feels like. And when we hear numbness or we hear tingling or we hear needles, that points us to potentially a change in the nerve endings. The central nervous system also can be affected by chemotherapy. Some people call it chemo brain. Maybe you've heard that term. It's real. It's real because our patients tell us it's real. It's very difficult to study, but I think patients clearly subjectively tell us that they may be a little bit more forgetful. They may not remember numbers that they usually remember. They become a little bit more disorganized. This is not easy. It does not tend to be permanent. So patients usually can sort of work through it. It doesn't always occur, however, right after chemo. Like you get chemo on Monday and on Tuesday you're totally fuzzy upstairs. It's not usually like that. But if you're on a 3 or 4 month program, some patients will start feeling changes in this area, in the first, say, the second or third month, and then it may continue after chemotherapy for some time. So you're going to have to sort of figure out maybe where your weaknesses lie if you start developing some of these changes. And you need to let your doctors know, because sometimes forgetfulness or changes in brain function is more serious, related to cancer or something like that. But organizing yourself, whether it's notepads or iPads or smartphones, focusing on one task at a time, journal about it. Sometimes we talk about journaling. Journaling is a very similar word to journey, and it's sometimes good to journal your journey. And you'll get some idea of how you're feeling over time. And you might notice by what you are writing down that things are changing. It doesn't happen to everybody. It does not typically cause dementia. It does not typically cause horrible confusion where people cannot function. But again, patients tell us that it's real, so it is real. Constipation, it's just an issue with pain medicine. For some reason, pain medicine causes constipation, and it doesn't wear off. So some side effects of pain medicines go away after 3 or 4 days. Sometimes the sleepiness goes away after 3 or 4 days. Constipation, for whatever reason, just stays on. And so you really have to be on something to prevent it, and you need to let somebody know if you're constipated beyond 48 hours. So there's obviously other ways to help with constipation. Drink plenty of fluids, some activity level, adding fiber to your diet, vegetables and fruits. And then, of course, your doctors have a number of different medicines to help you manage this side effect. So some pointers on constipation and diarrhea is call if there's constipation beyond 48 hours. Call if there's diarrhea really uncontrolled after 6 hours or so. If you wake up in the morning and you're having diarrhea and you keep going into the early afternoon, you ought to let somebody know and not wait 24 hours, particularly with some of the medicines that you may be on. And I would again ask your team ahead of time, can I expect constipation? Chemotherapy causes constipation, as we already described. So it's good to know whether or not they expect that or not. And the same with diarrhea. Do you expect it? How can I treat it? Do you expect constipation? How can I prevent it? Good questions to ask. This is a distress thermometer, and the reason I show this is because it's becoming a standard that we measure distress as patients are coming into our clinics and hospitals. We're not doing this full scale just yet, but I'm sure many of you have answered questions on your way in that kind of allow us to try to detect distress. And what this distress thermometer is a two-part thing. This is just, we ask our patients, how much distress have you had in the last week? Has it been horrible? Has it been 10 every day? Or has it been a pretty quiet week and you've been coping and things have settled down from your bad week last week? And then we just ask yes or no in certain issues of your life, which are the issues that are maybe causing that distress. So it could be practical things like transportation or insurance issues or child care issues. It could be relationship issues with your family, emotional problems, and physical problems. The reason this is important, I think, is because it reminds me that it's all sort of tied together. So this idea of a mind-body connection is real. And so problems with physical symptoms can result in emotional problems and vice versa. So patients with depression can develop constipation, for instance. People with anxiety can develop diarrhea. So this is a good reminder for me that it's all, we sort of have to think of it together. So the root causes of distress and suffering can be really from a number of different domains. Physical pain or physical symptoms can certainly cause distress. Psychological or psychiatric diagnoses, anxiety, depression, etc., can be a focus of suffering. Emotional changes, your social situation as we've described, issues with your family, issues with money, issues with jobs, keeping your jobs, how long can I stay away from my job? And then spiritual suffering, kind of where's my place in the world and how has it changed now with this diagnosis, or how has it changed now that I'm a caregiver when I used to be a breadwinner? So it's so there in the spiritual domain is certainly a focus of suffering for some of our patients too. My feeling is it's very important that your team know when you're having distress or when you're having suffering. And it's not easy to talk about, is it? Sometimes it's embarrassing. You know, like, gee whiz, everybody in the waiting room just seems like they are handling this diagnosis just fine, and I'm the only one that is depressed today. Or, you know, the issues of insurance is building up and building up. Every week it becomes a bigger issue, and I don't feel like I have anybody to talk to about it. Sometimes it's good to just write the issues out. If you're uncomfortable talking about it, write them out at home, bring them in and say, you know what, I'd like the nursing staff and the doctors to talk to me about these things today. You know, those visits in the clinic are not nearly as long as they should be, right? Doctors sort of in and out, always seem to be in a hurry, running late. When's the last time they ran early? But we need to know these things because your agenda should be our agenda. We may be thinking chemotherapy and blood counts and blood tests and x-rays, and you may be thinking something completely different. And there is no way to match them up unless we know. So it's my opinion that the agenda for the day for a visit should be your agenda. And what are the interventions? You know, obviously there's counseling, psychological type support. There's psychiatric attention for patients with true psychiatric illness requiring medication. Chaplains can help, whether it's your pastor at home or whether it's a chaplain here. And then social workers can help us sort of dive into some of the insurance and financial and child care and transportation issues that are out there. Not everything is solvable. Some of these problems are pretty difficult and frustrating for everybody. But there are things we can do. There are things that your team can do. You know, we've talked about yoga a few times today, and you know what yoga has been shown to do is it improves sleep, it improves fatigue, and it improves quality of life in patients with a number of different kinds of cancer. It's been most studied in breast cancer just because breast cancer is common. Acupuncture has been shown to improve nausea related to chemotherapy even, and pain. So it's typically used in addition to pain medicines, but it can help when nothing else is working. Meditation, mindfulness, this idea of sort of living in the moment, can actually be pretty powerful in patients who really are frustrated with pain control. And prayer or attention to your own spirituality can again sort of bridge that mind-body connection and help alleviate physical symptoms and suffering. I don't think we do acupuncture here. There are places in the greater Detroit area that do. Exercise we've talked about. If you can tolerate like exercise, it really will do a world of good. Just like kind of yoga, like yoga improves fatigue, it improves sleep quality, improves quality of life, and interestingly, it may extend survival. If you take a group of patients who have had chemotherapy and now are exercising regularly, and this other group only takes the chemotherapy and doesn't exercise, this group may do a little bit better over time. So it's one of those things that hopefully you're able to do. Not everybody's able to do it. Sometimes it's very limited exercise, but maybe it's just light weights while you're watching TV. So again, things that are more in your control. So lastly, I want to talk about buoyancy. A friend of mine who works at MD Anderson, really did a nice job in writing a paper on this topic a couple of years ago, and I've stolen all of his ideas. But the idea of buoyancy is, what's keeping us afloat? So there's things that are sort of trying to drag us down and causing us to sink. And so the question is, what are things that can keep us afloat? What keeps you coming back to the oncology clinic, whether you work there or you're a patient there? What keeps you coming back? What makes you keep coming back to the hospital if you work there and it's day in and day out taking care of very sick people? You might hear the term, it takes a special person to be able to do this kind of work, or it takes a special person to endure the type of therapy you're doing. Well, what makes that kind of special type of person? And this is a chart that he put in his paper, and we're going to talk about these briefly. These are all sort of things that contribute to buoyancy. Factors in our life, some are in our control, some not. The things that we can consciously sort of think about, and some things we can change, and it kind of keeps us going, keeps us afloat. So some of these parameters, one is autonomy, this idea that you have some control. So if you're an oncology nurse, you're going to be kept afloat if you're given some autonomy in your workplace to practice in your style. If you're a patient, having some control over your treatment decisions allows you to feel like you're a little bit more in control, a little bit more afloat. Exercise of skills, sort of an interesting one. This idea of kind of having the opportunity to do what you do well. So if you're working and you love your work and you're on treatment and you want to keep working, well, that's going to be important. It's going to be important for your team to try to make sure you stay working, if that's important. If you have a hobby that you really like to do, we should do everything in our power to make sure that you can physically continue to do that hobby. So this question of what makes you tick, and continuing to seek that passion will keep you afloat. Establishment of meaningful relationships. This could be at work if you're, again, an oncology worker, cultivating relationships with your colleagues so that you can share your highs, share your lows, discuss difficult issues, and take care of each other. And of course, it can be at home or it can be with friends, people who can really just share the load with you. I would say it's impossible to do this alone, whether it's the experience of having cancer or caring for a patient with cancer or working in the cancer world, if you will. It's impossible to do it alone. Being awake to your present reality. And the idea here is just sort of being in the moment and identifying where you are at that moment. I'm tired. I need to rest. I'm not going to push it right now. I'm sad. I need to talk to somebody. I'm really sad. Can't quit crying today. I'm feeling very alone. I need to get some help. This idea of sort of knowing where you are and seeking resources, seeking help. Sometimes it's saying a prayer. Maybe you're not seeking help from a person, but knowing your strategies. Gratitude. Count your blessings, people say. I think you need to recognize your blessings. Identify those things in your life that are going right. And thanking those around you for their gifts. Maybe you're taking care of a patient and that patient has changed you in some way. Pretty meaningful to actually tell that patient, thank you. You've made a big impact on me because of the way you care for your children, the way you continue to write. So gratitude goes a long way in sort of keeping us afloat. Not always having everything sort of coming at us, but us kind of stretching ourselves out. Courage. So courage to really identify your fears and confront those in some way. Not easy. Very difficult, actually. But having the courage to reflect on your fears and then to develop strategies to sort of accommodate those fears. You may not be able to get rid of those fears. It's likely that you can't, actually. But there are ways to confront your fears, and knowing that, when I'm feeling this way about this issue that I'm scared about, this is what I plan to do. So, not easy, and people talk a lot about courage, and oh, she is so courageous. And our patients oftentimes don't feel very courageous. The appreciation of impermanence, and this is the idea of sort of changes everywhere. Dr. Mount, in a famous paper many years ago, talked about this idea that to live is to experience loss. So all of us experience loss at some point and in some way. So recognizing that things change and recognizing that loss is part of life can make our transitions more acceptable. Change is hard, transitions are difficult, it is emotional. People cry at weddings, they cry at graduations. Any transitions are particularly difficult. So identifying the emotions that you have during a transition, and then again, strategizing for how are you going to be resilient? Who are you going to lean on? How are you going to handle this transition that's coming? And again, being awake to the present so that you're prepared for the future. Easier said than done. Believe me, I'm not an expert at that. Having a compassionate mind frame. So this is for caregivers as well as patients. Compassion requires empathy. Well, empathy, the ability to sort of walk in the shoes of somebody else. But you have to have empathy to maintain your buoyancy. And in order to have empathy, you have to have compassion. And compassion means to suffer with. But if you're not careful, then the suffering that you're facing is almost like gravity, and it'll draw you toward it, and you'll become less buoyant. So in order to you have to sort of be able to maintain your compassion in the face of very difficult things, maintain your empathy so that you can be present to suffering. And then extend that compassion. Share it with other patients, with family members, with friends. And most importantly, and the most difficult, is to extend that compassion to yourself. What keeps you safe? What keeps you secure? And trying to make sure you kind of keep those things around you. So what are the things that keep you safe and secure? Is it money, having enough money? Is it the type of job you have? Is it a religious community that you want to stay involved with no matter what? Whatever those things are that keeps you balanced and keep you safe and secure, you need to make sure that you hang on to them. So what are the unique parts of you and your family that are going to keep you grounded? And recognize those, name them, and nurture them. And the last one is answering the question, do I matter? This is hard. If you're feeling alone, if you feel like your suffering is isolating you, it may be helpful to think about this, reflect on this. Where am I making a difference now for others? Or where have I made a difference for others? Maybe I'm a retired teacher and I have had countless students come back to me to tell me how I've molded their lives. And if you're having trouble with this question, and I think most of us do at some point, it's useful to ask somebody else, where do I matter? Do I matter? How do I matter? How do I matter to you? Again, these are very, very difficult things. So we're back to our pathway, our path that we're walking. Again, I think my own preference, and some of you may think differently, is that we're all on a journey. And yes, there are days in which you're in a fight and you're in a battle. There's no question that that is the right mode of thinking. But I would also suggest that there are other days where you think about your journey and how are you going to be kind to yourself during that journey. So the journey is not just about chemotherapy. It's not just about radiation or robotic surgery. It's not just about side effects and side effect management. It's about asking questions. It's about advocating for yourself. It's about setting goals, knowing your destination. And it's about remaining buoyant, remaining afloat in the storms that you're facing. And just remember that we can't do it alone. Whether we're caregivers or providers, or whether we're patients or family members, it's simply not possible to do it alone. Thank you very much for your attendance. These are 3 websites that are just very good, solid cancer information. Cancer.org, cancer.net, cancer.gov. Very good websites.